you begin.
Thank you. So, hi everyone, and thank you for being here today. We have a lot of participants today, and we are excited that you are here with us. And thank you. Today, we're gonna be talking about stress management and during the pandemic in Hispanic and Latino, how we can work with our Latinx communities. So we hope that this information will continue to enhance the knowledge and the work that you're already doing. So again, thank you very much. Cindy, next slide. So during today's presentation, we'll be talking about identify specific stressors in Hispanic and Latino. We are going to provide some of the stress management skills that you can use with them, and also special consideration about mental health. And Danita Gallegos will be discussing about consideration in youth mental health. So it is important to stay until the end. And I think it will take a little bit more than 1 hour. I think it's going to be 1 hour and a half. And also, we want to let you know that on the handouts, you're going to see different documents that you can share, that you can read, and there's other information and links that can help you in your private practice. Next slide. So just a little bit of the background of Latinx in the United States. 59%, 59 million for US of Latinx are living in US, and it is expected that by 2060, almost 119 million of Latinx will be living in the United States. It represents 65% are US born, and almost 35% are foreign born. So just to have this background, I know that a lot of people already know this information about our Latinx community. Next slide. So I just want to discuss about the Latinx experience with mental health conditions. We're going to be providing this information. We don't want to stereotype, but we are using some research, and we want to explain some of the findings. But we are aware that Latinx community is really diverse. There is so much richness inside the Latino communities. So Latinos, they tend to experience stress and depression like with somatic symptoms. This is not specific only for Latinos. We can see this in all the cultures too. But for Latinos, we need to be aware of clients that are experiencing headaches or stomach aches, because it could be related not only to a physical condition, but also it could be related to the stress that they are experiencing. They also may experience they could express that they're feeling a little bit stressed, or they are more angry all the time, or they're feeling more irritable. So those symptoms we need to be aware of, because they could be related to stress. It is important to know that the difference that Latinx does not present more mental health condition in compare to other cultures, but Latinx, one of the things that we need to be aware of, that they present some barriers to access to mental health services, which include lack of mental health providers that are culturally sensitive, and also sometimes mental health providers that speak Spanish, and barriers regarding access to quality health care. Next slide, please. So there are also, we can have a lot of clients that they can see or believe that their symptoms are related to environmental, spiritual, or personal, of the cause of the stress is related to environmental cause. And sometimes it is difficult to understand when we provide psychoeducation to our clients. Sometimes it's difficult for them to understand sometimes the perspective that we are providing, maybe more like a biological perspective. So it is important to also integrate both perspectives, the environmental one, but also the biological perspective. One of the things that we can observe is sometimes we can have clients that they don't want to receive psychotropic medication. And this is a struggle. I know that about that a lot of mental health providers are experiencing. I experienced it by myself. I have a client that she was a grandmother and she was taking care of 5 of her grandkids. So she was experiencing difficulties to falling asleep, difficulties managing her anger, difficulties with nervousness and crying spells. So we tried since the beginning to let her know that it was important to have a psychiatric assessment, but she was refusing and refusing. So she had a 2 stroke, and then she like saw herself like more vulnerable. And then in psychotherapy, we continued to provide more psychoeducation. Then she said, okay, I will go to the psychiatrist and have an evaluation. But this take a lot of time, and it took also a lot of patience and a lot of psychoeducation. And one of the things that I let her know, it was like we can go together. It was the session was going to be inside the office that I used to work, and I let her know I can be there with you. I can translate for you, and if you don't want to take the medication, it's okay. But this is the first step. And talking like that and talking with her, negotiating with her. She said it's okay. So she went there. She got her medication, and then her symptoms of stress and anxiety and crying spells that decreased. This is just to share you an experience that we can observe in a lot of our clients. It is important that when we are providing services to Hispanic and Latino, not only observe that things that they're lacking of or the problems they are experiencing. As mental health providers also, it is important to observe that they have strengths. So we need to use a strengths-based framework. It means that inside the Latinx community, there's so many things that can help the clients to overcome the adversities that they're going through. So the relational resiliency means that there's a family connection. There is support inside families that help them to grow. Sometimes not all the families are real support, but as many Latinos like to be with other people to share their thoughts, to have pláticas. So we encourage to all mental health providers, when you're providing services to Latinos, to be aware of the strengths that are inside of the Latinos, just like the importance of familismo, spirituality, and also some of Latinos, they have pride on how they educate their kids and how, and also the rituals they do that help them to remind or remember their cultural experiences. Some of the examples could be celebrating the Hispanic Heritage Month. Sometimes it could be related to having a special dinner for Thanksgiving or during Christmas. So maintaining that cultural values that they had is a huge asset that Latinos will have. Next one. Okay. So after addressing that, Latinos, they already have a lot of strengths in we have a lot of strengths in our culture. Also, it is important for this presentation to acknowledge what are the most frequent stressors that Latino may experience, right? Because the stresses that I'm going to be talking about add another layer to the stress that they're experiencing right now due to the pandemic. They may present economic status and poverty, which means that almost 22% of Hispanic were living in poverty, as reported by the Office of Minority Health during 2019. And right now we can see this in a lot of workers that they need to stay at home, they cannot go to work, they cannot work from home due to the pandemic. So this is another factor that we need to address inside therapy. The language barriers, acculturative stress that we know that a lot of Latinos are presenting. Sometimes we experience that by ourselves when we move from one country to another. And on my own life experiences, I experienced some acculturative stress. Acknowledging the difficulties in language, acknowledging that you are in a new culture, experiencing new experiences, and also presenting some struggles related to the language, related that your family is not near you. We can observe that maybe Latinos could be having second thoughts about that why or the reason that they moved to the United States. So be careful about those thoughts, and also the risk of suicidal ideation in this moment in our Latinx community. Next slide. So the discrimination, sorry. A lot of Latinos will know they experience discrimination. One research that I really like to use in a lot of my presentation is the research created by Chavez et al. In 2019. She talks about healing interracial trauma in Latinx community. Sorry. She addressed how Latinx interracial trauma can impact Latinx communities, and not only when they witness, but also when they experience it by themselves. So other issues that factors that affect the stress in Latinx community are the legal status, deportation. Right now, I read a news about 3 kids that they test positive for coronavirus, and they were in a detention center. So this is, I know, is a really big concern right now. And there's a separation due to immigration and also other trauma. It is important to understand that a lot of Central Americans are experiencing political trauma in their countries, and then moving to the United States and experiences now this pandemic will add another layer of stress in their life. We need to be aware of symptoms of PTSD or generalized anxiety disorders, and also depressive disorders. Next slide. Thank you. Impact of stress in Hispanic and Latino populations. There are so many, we know about the impact of the stress in everyone. We know that chronic stress, it impacts our immune systems, impact our relationship, our concentration, our attention. But specifically with Latinx, one of the things that I want to acknowledge is that older adults in Latinx communities sometimes could present exacerbated symptoms because maybe they be living alone. So isolation in older adults is something that we need to be really careful in how we psychoeducate them about what is happening right now. During this week, I have a 94-year-old female that came to my office with her daughter, and one of the main issues is like she was having difficulties to understand what is happening right now. So the 94-year-old woman, she wants to go outside, she wants to go to the casino, she wants to go shopping by herself. She has so much energy. It was impressive. But what the therapy consists of was that to give her a little bit of psychoeducation and let her know, even though she was showing to me her medication and she was just near me, and I was like, okay, we need to address this. We need to talk to her about how that the importance of to having a distance between another person, because not because only of me, because of her immune system. I was really concerned about that. So explaining to them, maybe repeat it to them several times what it takes to that we need to be careful, that they need to be careful with their health. It is so important, and sometimes they don't they have difficulties to understand it, or sometimes they don't see how the seriousness of the situation. Or we can have others that are really concerned, or are really stressed, or their experiences of a lot of anxiety. We can worsen chronic health conditions. We can observe that in our clients, and also fear of their own health and about the health of other family members. Sometimes we can have Latinx that are like living in the same room. Sometimes in Los Angeles, the rent is so high, so expensive that you can have uh, 4 to 5 family members living in a studio. So this is something that we need to be aware of, and we can ask our client the safety measures that they're using in this moment. Next slide, please. We can observe increase of using different alcohol, tobacco, other drugs as a way to cope with the stress that they're experiencing. Increased sense of loss, not only about what is happening right now, but loss more physical, and also loss of connection with their culture or with their families. Because if they need to stay inside home, they cannot go out. If they used to have people used to have a routine, and they used to go to a support group or a community center, now they need to stay inside their houses. So we can also observe that maybe we provide some skills to our clients and they cannot use them right now. Some of the things that I try to explain, maybe we can provide another, like if you cannot go out to take a walk or run, maybe you can walk inside your house, or you can download a specific app that so you can do exercise inside your house. So we need to do modifications to those coping skills that we already provide to our clients. We can also observe changes in sleep patterns, and eating, and also be aware of the somatic symptoms that our client could be experiencing. Those elements are important to be aware of because they can exacerbate the clinical presentation of our clients. Next slide, please. Okay. So here, again, just want to provide this information to you. We know that a lot of Hispanic and Latinos may explain what is happening right now, and maybe they think that is a curse. Sometimes they have difficulties of acknowledging what is happening right now because they can see only as that this is a punishment from God. So we can explore some of this belief and stigmas using the cultural formulation interview that I will be talking a little bit further. But it is important for practitioners to especially explore those beliefs and how it affects the mental health and how it affects especially the treatment, and educate, provide psychoeducation, and it is important that we can incorporate those values inside our practice. Next slide, please. So challenges that we can observe in our Hispanic and Latino. So usually they don't like to go to a doctor. Not necessarily because they don't have a health insurance, sometimes because of the stigma related to going to a doctor. Sometimes they wait until they have a lot of pains on their body and then go to a doctor. We need to clarify that we can observe different behaviors depending on the degeneration of our client. We can see maybe first generation, maybe they present more difficulties to go to the doctor. But if we talk about second and third generation, we can see some differences because they're a little bit more open to go to a medical office or to go to a psychiatrist or to get mental health services. So we need to be aware of that. We don't want to stereotype. So we can use and see how a lot of Hispanic and Latinos, they take into consideration the recommendation of mental health providers when they have when they establish a relationship, or when the therapist or the provider spend some time creating that engagement inside the session. That is really important in the therapy process. Next slide. Okay, so here I just want to share some of the instruments that you can use to assess stress in Hispanic and Latino. The first I want to say that you can use the cultural formulation interview. The National Hispanic and Latino Mental Health MHTTC provides different trainings of how we can use a cultural formulation interview, because it's a key instrument that you can use to acknowledge how the person is seeing what is happening in their life, how they can see or understand the struggles, and also to have a better understanding of the words that they use to express pain or to express or to acknowledge what they are going through. See, it is a recommendation, the cultural formulation interview. And the Hispanic stress inventory, there's the second version. Also, there is a adolescent version. Both are in Spanish. On the handouts, I attached a document with the resources and the link where you can find all of this assessment. So they're there for you. You can just download the handout. So after we assess, next slide, after we access how made an assessment of how the stress and this pandemic is impacting our Latino clients, we can then provide some recommendations of how we can manage this stress right now in this pandemic. One of the first steps that it is really important is to provide psychoeducation. When you provide psychoeducation, it seems simple, but it's not. Like, you are addressing the belief, you are addressing stigma that they have about the condition. So knowledge is power, right? So just talking about psychoeducation, about what is the COVID, you can go to the CDC webpage to have more information if you're having difficulties to understand about the virus. Also, the next step that I will say, acknowledge that factors that may influence the understanding and view of stress. Cultural factors may impact how they view stress. Sometimes we do not validate the emotions that we're experiencing. And you can see Hispanic and Latino that, yes, I'm crying all the time, or I'm tired all the time, or having headaches all the time, but I think because I'm working a lot, or because, or I need to pray more, or I just need to go to bed. So sometimes a lot of invalidation in the Latinx community is observed. We can understand that we can acknowledge that inside our Latino, there is so much diversity inside our diverse. We can have Latinx that are from Mexico, Colombia, Puerto Rico, and they present like a more specific struggles and also sociocultural stressors that are more specific to their country. It is important to help the client to create a plan for them to stay connected, to have a support system. And if they don't have a support system, we can sit down with them and help them to create a support system. Who is the person that, if you have a neighbor that could be, can you talk to, even if it is from the window, just saying hi in the morning. So we need to adjust what we can do during this quarantine. Next slide, please. So here are more specific recommendations that I want to include. It is the storytelling of pláticas. Storytelling inside Latinx communities, you can use it not only like talking, but also you can use other instruments, just like drawings. You can use poems, writing as a way to communicate what is happening. In storytelling, there is so much healing. It helps us make sense of what we are experiencing also, and make us to organize our thoughts. And also sharing it with someone else helps us to feel a little bit more calm, right? That something that we need to be, or we can let them, our clients know, is that this is a shared experience. So we need to find elements inside our story that could help the client to be more, to normalize what they are feeling. So pláticas is like more like informal conversations where we can obtain a lot of clinical information and we can use it inside of our sessions. The next one is dichos. Dichos are sayings or proverbs that it will help the client to make sense, or sometimes it helps the client to have more, to be empowered and about how to deal with the situation. Some of the most frequent is no hay mal que por bien no venga, right? Or that after a storm comes a calm. Más vale prevenir que curar. And stitch in time, save nine. Sometimes it is difficult to translate some of them, just like una pena entre dos es menos atroz. A sad situation shared by two people is less heinous. So sometimes it is difficult to translate, but if you only speak Spanish and you're with your client, you can explore like which dichos or proverbs do you use before that help you to go through a difficult situation and how that makes you feel. And this is something maybe that you can repeat to yourself so you can be more empowered, or you can acknowledge the strength that you have inside you. So this is one of the recommendations. Next slide. Okay, guidelines to be aware of their emotions. One of the things that we can try to do with our client is to use the scale from 0 to 10 to measure how they're feeling stressed, right? Let me know from 1 to 10 how stressful you're feeling right now. But also from 1 to 10, let me know how in control you are of your personal situation. From being 1 is not control at all, and 10 is you have the control of the situation, right? Because it will help us understand, is our client usually a 6 or 9 in anxiety or stress, or he is a 6 right now because of the pandemic or the COVID? So we need to make a baseline. We understand the client's baseline, and after that, we can check in with the client and let them know which activities you think you can do to reduce the stress that you're feeling right now. Sometimes we can have clients like, I'm stressed because if I get sick, I don't know what I'm gonna do. I need to take care of my family. So one of the recommendations is to check with them. Do you already made a plan? Like you have, like what happens if you actually get sick? Where you need to go? Like if there's somebody else in your family with the virus, what they can do, how you can take care of them. They can share, they can create a plan, and you can help your client create a plan, but also including other family members that, and that the plan will adjust to everyone's needs inside the family. So this is one of, I would say one of the main recommendation is to let them know that they can use the stress that are experiencing to in a positive way. They can create a plan if they don't have it. They can think about places that they can go if they get the virus, how maybe to find support inside their communities or talking to other family members, so they can acknowledge that stress, doing something that could be beneficial for their family, right? To have a plan. This will help them also to reduce in some way the stress, and also paying attention to a specific task. Because if they're in the house, like we have a lot of abuelitos watching the news the whole day, then we can see an abuelitos and tias that having a lot of stress because they're watching during the whole day the news. So this is an activity that maybe we can help our clients to create a safety plan. We can normalize their emotions that they're experiencing and also demonstrate empathy through the whole situation or through the whole storytelling that they are providing to us. It is important to be acknowledge the nonverbal communication. I know that a lot of therapists now are using Zoom or using Skype or other telemental health forms of providing therapy. It is important to acknowledge if they're not sleeping, if they have ojerejera, I say in Spanish, if they are presenting like more, they're not eating, or if they're not taking care of themselves. So this is something that you can be aware of while you're providing telemental health. Next slide. The next slide is more general recommendations about to create activities, to take breaks from the media, and this is, I would say recommendations are for general population. Next slide, please. So here, it is important to provide interventions that in multiple levels. With this pyramid, you can observe and you can use it with your client to check if your client, if they have different support in different levels. So we have the social considerations, we have the strengthening community, we have person-to-person services, and more specialized services that will include mental health services. This is something that you can use in your agency just to make aware that the clients that you are serving, they are having services and support in their community. Next slide. Okay, so this is more like interpersonal psychotherapy tool that I like to use with my clients. This is the first one is the interpersonal circle. This is something that you can use even if you're on the phone. The client will need a paper and there can write a dot in the middle and then two circles. You can let them know, could you write the names of people that are support for you. So people that are near the dot is people that are more near you that provide higher support. And then people that are on the outside circles are people that are there, but they're not a huge support. This will help us understand the support systems that our clients have and how we can ask questions on how they support you, or are they near you, are they in their countries, or are they living in your house. The next tool is just to ask about different situations that they went through and then serve as a discussion about how you went through those difficult situations and acknowledge the skills that they already have and use those skills that they use to deal with different difficult situations in their life. And then inside therapy, we continue to enhance in those skills. The next one, please. Okay, so this is another tool, and we can use this transition. This is a timeline, and we can use it as a way to understand different events that our clients experience that make a huge impact in their lives. So there is an arrow because it means that the life continue, and we are going to experience other kind of experiences that could be bad or that could be good for our life. The line in the middle, it's a specific event that you think that changed your life forever. It could be good or it could be difficult. It doesn't matter. And then your client can write the different events down, and this is something that you can use as a conversation with your client, and you can observe how different the roles and how they change in their lives. The next one. There are so many resources that you can find or you can use on the internet. I know sometimes it's difficult to find resources in Spanish. Here I provide some information regarding psychoeducation to our clients in Spanish. It is also in English. Then the second bullet is a link for food and utilities that they're specific for Massachusetts, but also they have other resources that are more national. The next one are different trained counselors that our clients can contact. Or we need to be aware that sometimes we are providing services to our client, but we can see that our clients having a lot of difficulties with other members inside the family, and they don't want to be in therapy, and they're scared that maybe a suicidal ideation. So you can share these resources with them. So in case of emergency, they can contact the Stanza Disaster Stress Line, or also texting with Háblanos, that is in Spanish. Again, you have all these resources on the hands. Next. Okay, so the VA developed different resources. They can be used by mental health providers that are serving veterans and also other clients. And I think they are on their web page, and they're really useful. So there's a lot of resources that we can use for our clients. Next one, please. Here are other resources, the National Suicide Line, and also we have Casa Esperanza that provide bilingual services to our Latinx community when they experience domestic violence or intimate partner violence. Next slide, please. I'm just going through these slides because you have this information already on the handouts. It is important to acknowledge, sometimes we think like Latinos who have therapy using a cell phone, or I don't think that Latinos have the same access as other culture, but the research of Pew Research studies and analysis express that 86% of Latinx own a cell phone, and also that almost 80% of our Latinos have use mobile internet. So this is information that you can have that acknowledge that Latinos, we can address health disparities in Latinos with the telemental health. The next slide. So here are some research regarding the impact of using telemental health in our clients, in Latinx clients. In the resources handout, I provide a link where we have other research that you can use and you can find. I know that when we are providing telemental health, if we are doing a specific intervention, we need to have like a research that sustain that intervention that we are doing. So those are like some of the research that you can use. The next slide. Yeah, you can go to the next slide. Okay, so I just want to talk about consideration about telemental health. There is an expansion of telemental health 1135 waiver. It can be increased. It's valid for 60 days, but it has an increasement of by 60 in a 60-day increasement. It said that doctors, nurses, clinical psychologists, and also licensed social workers can provide mental health using Skype. They can use FaceTime. They can use Google Hangouts during this emergency. So this is information that I think is really useful for mental health providers, and be aware that if you are in, let's say, Massachusetts, you can provide services to clients that live in California, that live in Ohio during this emergency. Next slide. Another important information that we need to be aware of is the public health emergency response. And this allows the provision of information to another program about a client with a substance use disorders without the use without the consent of the client during a medical emergency only. You can find more information about this at the CMS website. And here are some resources for providers. I will say thank you for the work that you're doing right now. And thank you for being there for Latinx, because not all providers work with Latinx. So thank you for that. And also you need to take care of yourself, right? We need to take care of ourselves. And here are some resources about how we can be more educated about what is quarantine, social distancing from SAMHSA, what is the coronavirus, and also how to manage our stress. Also, the telepsychology best practices 101 is a free webinar. It is like 4 to 6 webinars that you can take, and it provides you a better understanding of how to use telepsychology. Next slide. Okay, here we have more resources, and I think it is really important to all providers to be aware that the stress in Hispanic and Latino who also have an impact on, and we can observe that our clients who have experienced susto or also who experience nervios o ataque de nervios. Susto is frightened, nervios is nerves, and also ataque de nervios is nerve attack. And this is all cultural idioms of distress that are specific for Latino culture. They provide explanations to the symptoms that are experiencing, and also is a way to express that they're on distress. So if you want to learn more about the idioms of distress inside Hispanic and Latino, the National Hispanic and Latino Mental Health provide training about how it affects, and also they are on the DSM-5. So here are more resources for all mental health providers. Important to be aware of our Latinx that are on jails and Latinx that are presenting maybe incapacity of moving. So there are some resources on the handout that will help you to go to read, to also acknowledge Latinx that are more in risk of having the coronavirus, of getting the coronavirus. So I would say I think this is the last slide. Thank you very much, everyone, and back to you, Stanley.
Thank you, Isa. Sorry for the delay here. We're having issues on my end with the connection. Danita, I'm gonna hand it to you right now. I'm trying to make sure that the system does what I'm asking it to do. Sorry, everyone, because I keep having issues with
Um,
this.
so before I start, I want to give a website.
Beautiful. Let me mute myself. Sorry. Just it's giving me as much issue to unmute you as it gives me to mute myself, but I'll try to do it as fast as I can.
Okay, I think it worked. So before I start, I want to share a website that has some health literacy that may be beneficial. Believe they've done a lot of focus groups, so I actually put it in the chat section if you all can see it. But it's called Fotonovelas, and it goes through hypertension and breast cancer and different things that Latino community members or just general population can also go through too. But for the Latino population, we talked about, Isa talked about how the response is they typically wait until there's some body pains, headaches, more of the somatic symptoms. So I actually heard it on a talk radio show, and if you guys want to just flip through that website and just kind of search around, I thought it was a good resource that maybe you all can benefit from. So my portion, my background is social work and school social work, and so my portion is a little bit of a different style. But hopefully it's beneficial for everyone. Isa had some amazing information, and so hopefully this is the way we can connect it. And mine is focused on children and families. So there's some information that I believe is important in addressing the mental health of Latinos and Hispanic youth at this time. So things to consider. Latinos are more likely to present mental health disorders that include anxiety, depression, PTSD, and substance use disorders. So two big components are Latinos are less likely to seek mental health treatment, but also Latina high school girls have a high rates of suicide attempts. And so there was a study done in 2017, a survey that was out, and it basically showed that ages 10 to 17, that it was a very high population of Latinas who have either sought out a plan or who have attempted suicide. So I believe it was 1 in 10 who actually attempted suicide and 2 in 10 who actually had a plan developed. Next slide. And I'm going to try to go pretty quickly through this. So our next slide is a conceptual model. Just going to go quickly through it. So that we believe there's 4 mechanisms that are responsible for disparities in mental health outcomes as minority children and adolescents transition to adulthood. So we have the socioeconomic status, childhood adversities, family structure across development, neighborhood level factors, are the 4, and the potential role of individual and neighborhood level protective factors, which could be social support, religious, neighborhood stability. Those things act as buffers against the negative effects that lead to the poor outcome of mental health care. So next slide, and that's a study by Alegria in 2015. The next slide just reviews some of the barriers for our youth. Lack of insurance is a huge factor. Lack of knowledge and awareness about mental health problems. So that goes with just kind of psychoeducation and literacy. School counselors and school social workers and social workers in general tend to provide a lot of psychoeducation and bringing awareness to our youth. And so that's important for us to be knowledgeable about things like that. Cultural stigma associated with mental illness. So Latino and Hispanic populations tend to believe that seeking treatment just makes you crazy or identifies you as crazy. And so the cultural stigma associated with that makes our youth not want to go because then they're seen as crazy or they're seen as the crazy one in the family. Language is a huge factor. So language can delay treatment for years to decades, or it could potentially cause non-compliance. So a big population of Spanish-speaking only or non-English speakers will just take the medication from the doctors because culturally it's respectful just to agree with someone in authority, and so that includes doctors. So they'll take the medication, they'll agree to everything, but then they won't take it because it makes them feel bad. And then when we go for checkups, the population will typically say, yes, I'm taking the medication, it's fine, everything's good, even though they're having the same symptoms because they haven't taken it. So that goes with just kind of being ashamed to admit that they're not taking the medication. But language and having the appropriate interpreters can actually solve that, a big part of that problem, and just the education behind it. Lack of culturally tailored services and culturally competent mental health professionals, shortage of bilingual or linguistically trained mental health providers. I believe it's something like 11% of mental health providers are Latinos. And so if we're looking at, and not all Latinos are bilingual. And so if we're looking at that, we have an even smaller percentage available to our Spanish-speaking populations or other speaking populations. Difficulty recognizing emerging signs of mental illness, problems identifying psychiatric symptoms when the chief complaint is somatic. And so again, it goes back to those somatic complaints of I have a headache, I have a stomach ache, my anxiety is just because, you know, I'm just nervous, things like that. You can go to the next slide. So this is a big one that's going on right now amongst the COVID fears. And so these are some additional concerns and fears for undocumented families. I have had a few interactions with people and clients. I work two jobs, so I see clients and then I see patients in the hospitals right now, psychiatric patients. And so what two situations I've come into that I've encountered just the last week were with two housekeepers who cannot clean houses anymore because of the stay-at-home order. And so we had to navigate that system. With those women, one of them was actually in an ER and she was extremely concerned about finances, and it led her to have a nervous breakdown. She wasn't sure how she was going to feed her family. She is undocumented. Her 19-year-old, I believe, daughter attends the University of Texas. That has completely shut down. So now her 19-year-old daughter is home. So that's an additional mouth to feed, and an additional person who cannot go out and get work. And I believe the daughter was working at college or at a place near her college, and she can't work anymore. So the income has completely shifted for some of those families, and they will not be receiving a stimulus support check, and they cannot receive unemployment benefits. And so we have a huge part of our workforce, the parents are unable to work, and that trickles down to our youth. And as we all know, the youth can feel in many changes within the family dynamics, even if they don't hear it verbally from the parents, it's not explained, or they don't see it physically on checks or bank statements, they definitely feel it. Unsafe work environments, so employers are directing workers to leave after any curfews that are being set. That's a dangerous situation and additional fear. With our undocumented families, fear of driving during the shutdowns because they're not sure if they're going to be pulled over or fined. And some of our undocumented people do not have identification. Next slide is a lack of health services if exposed. So we do know that that it will be covered if it's COVID related. But if it's not, it's just a shift in the healthcare system for our undocumented families. I know, and of course it changes county by county or city by city. I'm in the Houston area, so we do have, thank God, a wealth of resources, but it could change per area. Another concern is not being able to go to church. Church is a huge support for some of our Latino families. And so, and then the last one is decrease in college university motivation for undocumented families. So we have our juniors and senior kiddos who are prepared to go to college and who were in their spring semester and ready to make those moves. And now families are suffering financially. And so they may be entering the workforce, helping do whatever they can so that they can help with family finances. And then that might lead into summer and into fall so that families can catch up. And so that might deter some of our juniors and seniors who were set on going to college, going away to college. The next ones are pretty important. I added it in here because I'm not too sure how many people are aware of it, but public charge considerations. So the public charges are pretty much associated with public benefits, and this is associated or related to people who will be eventually applying for citizenship. So per the U.S. Customs and Immigration Services, the public charge rule does not restrict access to testing. So public charges, and you can switch to the next slide so that it makes a little more sense. Actually, the next slide was taken out. Okay, so I had one in here. Just go back to public charge considerations. I had a chart in here, not sure what happened to it, but there, if you go to the USCIS website, keep going back, go back slides, Cindy, to public charge considerations. So Cindy, if you can go back to the public charge consideration slide, that would be helpful. If you guys go to the USCIS,
that's where we are. I'm not sure. There might be a delay, but because that's the slide that I'm looking at right now.
Okay. The public charge rule is basically related to food stamps, Social Security, insurance benefits, and things like that. So federal public assistance. The point of it is that the COVID testing will be covered, and it doesn't count as a public charge. What our government is looking at right now with people who are applying for citizenship is they want to make sure that the person who is applying is not a burden to, I'm trying to find the politically correct way to say this, but kind of a burden to society. And so if that person is utilizing food stamps and other federal programs, then that's considered a public burden or public charge. And so I'm doing air quotes for those who can't see me. It goes against them when they apply for citizenship because they want to make sure that they're able to financially take care of themselves. And so one consideration when all this was going into play is to last week was to make sure that the COVID testing doesn't fall into a public charge. What we do know is that it does not, and our undocumented families are able to go and get testing, and it's not going to go against them. But if you go to the website, you'll be able to read a lot more on public charges. That's important because you can go to the next slide now. Because this does weigh on the mental health considerations for the whole family. So it increases the family stress and confusion. The support is needed through community and schools, local churches and things like that. So those of you who work in the school system, this is where the community resources will benefit us tremendously with the undocumented population so that they're getting a lot of their help through food programs in the community or through the church. I know in the Houston area, we have something called Backpack Buddies. And so each a school can apply to be part of Backpack Buddies through the Houston Food Bank. And the Houston Food Bank will send a bag of food home weekly. And so these are things that are undocumented kiddos can sign up for. Most kids can sign up for if they have free or reduced lunch, but this will help out our undocumented kiddos versus telling the family to go apply for food stamps. And so that's going to be how we have to try to navigate the system right now. And that increases the family stress. It causes some confusion. So anything that the school or the community can do to help would be more beneficial than going through and trying to get some type of assistance and applying for assistance. So the best thing to do when you have an undocumented family is just to refer the family to a nonprofit immigration advocacy organization that has legal representation, because the legal representation, the lawyers will look at it from a long-term standpoint versus the short-term standpoint. In Houston, we have PL Houston. They're amazing. They know pretty much all the resources that are in the Houston area. And then we have the Houston Immigration Legal Services. So if you can pair up organizations like that, that would be helpful. That would reduce stress on the parents, which then reduce stress on the kiddos. And then we go into, next slide, the children's emotional well-being during the pandemic. So definitely across America, there's been disruption in the classroom. I know the clients that I do see, they're struggling a lot right now. I see mostly children and teenagers. They're struggling a lot right now because they don't have that social support and the social reward of just peers. And it's been really hard on them. We're seeing a lot of more outbursts. We're seeing a lot more anxiety. I have one kiddo, she's about 15, and her depression has just plummeted, her depression symptoms, because she gets a lot of feedback and a lot of positive praise from her friends. And so there's a good amount of codependency that's going on there, and she doesn't have access to that. So the children may be struggling with significant adjustment due to the schools and childcare closures, social distancing, and then at home confinement, and just struggling with siblings. I know if I was in this position when I was younger, my brother and I would have probably killed each other by now. And so just parents navigating that is really hard. Next slide, children's emotional well-being. So prior history of trauma or pre-existing mental, physical, or developmental problems, as well as having parents struggling with mental health disorders, substance abuse, and economic instability put children at a high risk for emotional disturbances. We can't be blind to the fact that we know that some of our kiddos' parents do have substance abuse issues and concerns, and so now our kiddos are at home with them. And so we're not too sure what may be going on with that. And so just something to be aware of when checking in on the students and kids that you may be assigned to through your profession. Next slide. So common changes to watch out for include excessive crying or irritation in younger children, returning to behaviors they've outgrown, to regressive behaviors, bedwetting, sucking their thumb, being a little more clingy. Those are things to watch out for. Excessive worrying, so wondering what the coronavirus is going to do, wondering about their grandparents. Are their grandparents going to die? These are questions that we're seeing with our younger ones. And so offering reassurance and staying ahead on the psychoeducation of this is important. Unhealthy eating or sleeping habits are something to watch out for. With all of my clients, I really focus on sleep. Because what we do know is that when you don't get appropriate sleep, you're not able to clean those stressors out of your brain at night. And so the way I describe it is that if we don't get our full sleep cycles, we're not cleaning out our brain of those sleep germs, is pretty much what I call it. And so we need those cleaning chemicals to go in at night for 7 to 8 hours to make sure that our stress goes down. And so the sleep habits are extremely important. Next slide. Again, we go back to irritability and acting out behaviors for teens, just kind of that talking back, snapping, things like that. Will give you a clue that their anxiety is increasing, or their the stress level in general is increasing. Avoiding school, poor school performance, and so we want to check in with those kiddos who haven't signed on to any type of virtual learning platform to see what's going on. Another thing we do know is that when in crisis, we don't think as well. And so if a family's in crisis and they're worrying about how their parents are getting food and getting income, then school may not be important to them right now. We also have our kiddos whose parents may be working all the time. Our parents that are in, or guardians that are in the healthcare system and who aren't home right now. How are they dealing with everything? Difficulty with attention and concentration. Again, we go back to when we're in crisis, it's hard to concentrate. Avoidance of activities enjoyed in the past, unexplained headaches or body pain, use of alcohol, tobacco, and other drugs. You can keep going. So coping with stress and fear, and we are going to get to some coping strategies. So just coping with stress and fear when treating Latino children, youth, and families. We know that there's different reactions to the pandemic. Some of our kiddos have been through some really political trauma and a lot of crisis in their home countries, if they're not from here, or if they live in a very tough neighborhood. So the pandemic may not strike them as much. These are our kiddos who are constantly living in fear, or constantly who pretty much grew up in a crisis-oriented household or neighborhood, and so they may not be reacting the way that we assume that they should react, and that's okay. We just want to meet every kid where they are and try to figure out what their current worries are, their current stressors are, and work from there. Physical distancing should not mean social isolation. I feel like the country has kind of got a grasp on that with FaceTime and different avenues of just social media and connecting through social media. I know there's an app called House Party where different people can get on and just kind of socialize through that platform. Information should be age appropriate and culturally appropriate. Create a safe physical and emotional environment by practicing the 3 R's: reassurance, routine, and regulation, are some great just guidelines to go by. If the kid is having trouble regulating emotionally, then we start there, and figuring out what the biggest worry is. I call stressors worries because it's easier to explain to my clients. So that's why I use that word a lot. Coping with stress and fear. So some coping strategies that we can incorporate is keep them busy, build a daily routine, maintain connection with community using technology, incorporate closeness and safe physical touch in a different way, right? So we can't go outside and play with our neighbors, we can't play chase, we can't do things that are physical touch, we can't hug grandma and grandpa, we can't do a lot of the things that brought us comfort before, but we have our pillows, our blankets, our favorite stuffed animals, and our pets who we can get some type of physical warmth from. Next slide. Daily mindfulness practice. So this is a huge one that I use in practice: deep breathing, meditation, stretching, yoga, and guided imagery. So through research, what we have found is that using some mindfulness practice will slow down some of the alertness that is constantly going on with our kiddos who have experienced a lot of trauma. So our kids who've experienced a lot of trauma, their amygdala in their brain is constantly going off, or going off more than the average child. And so through mindfulness, consistent mindfulness practice, we've learned that it can help that child lower the amygdala alert system. So, and there's tons of apps and tons of videos that you can utilize right now to either become trained in some of this stuff or to send over to your clients and your kiddos. Step outside. So we don't have to necessarily be close to people when we step outside. We can go and get just fresh air. There was a study, and I don't have the information on me, but there was a study done where they compared two groups in New York. It was a workplace, and so one half of the group was mandated to go outside 3 times a week. They had to take a 10 to 15-minute walk and not be distracted with anything else. So no books, no electronics. They just had to walk and enjoy the air. The other group was allowed to do whatever they want. And what they noticed is that those who abided by the no distractions rule and just step outside, walk around, they actually took their blood and took samples, took labs, and they noticed that the stress response system was a lot lower in those who utilize nature as a point. So sensory input, so drinking hot tea, cold drinks, warm baths, scented candles, essential oils, and Play-Doh. So this goes back to our 5 senses, and there's a portion in our brain that when we are in touch with our 5 senses, it calms us down. And my recommendation is always 15 to 20 minutes. If you're upset, if I have a client who it's tough for them to emotionally regulate, stepping out for 15 to 20 minutes and doing something with your 5 senses will help lower our stress response system. So it is pretty close with grounding, using the 5 senses to connect to the present moment. It's just kind of taking it a little bit further. And then movement and exercise, so adjusting from a vulnerable position to an active stance can adjust our physiology in a positive way. So it increases those endorphins and get your body chemicals going so that you have some type of positive chemicals and positive coping mechanisms that you're using. And then we kind of discussed grounding using 5 senses. Grounding is a big one that we can just search for. You can search on the internet and find a lot of graphics on that. Identify person sources of positivity. So a lot of kids connect with teachers during the school year and they feel like they can really depend on teachers. And so this is where if we work in a school system as a school social worker or school counselor or administrator, this is where we want to utilize our teachers and just remind them that if they have a kid who's expressing some concerns, to relay that information back to us. Because teachers, they're just used to handling it. And so we may just want to put that word out. Coping with stress and fear, so create things that bring satisfaction. Again, keep children busy with light problem-solving activities. Coloring is a huge coping skill. And then limiting news and media input and asking for help. Issa shared some great resources earlier, a lot of crisis hotlines and things like that. A lot of counties are they're coming out with COVID mental health hotlines. And so those are things that we can utilize too. Next slide just kind of reviews telemental health. With our Latino population, what we do know is that they don't access telemental health and the parents may not trust it as much. And so we just want to take an extra moment to reach out to our parents who are a little hesitant in using it, just to explain how it's used, ensure privacy as much as possible, explain confidentiality. But with the Latino population, they may be a little more hesitant in allowing their children to connect with someone through that platform. So just taking an extra moment to utilize it. And you can go to the next slide. An advantage of using school-based telemental health or just telemental health teletherapy right now is that in the general system, pre-COVID, there weren't a lot of options for teletherapy, and now there are. The other good thing is that we have access to more bilingual people, and so that's helpful in itself too. Disadvantages or just concerns about privacy. And so again, just reassuring our parents, reassuring our guardians, grandparents, and the other population and the rest of the population that there is some type of confidentiality set in there. Of course, when we go to someone else's home with using teletherapy, we can't really ensure what their space looks like, right? And so just kind of coaching them on how to create a space for their child that is as private as possible. Using headphones is helpful. So things like that, we just may have to talk through with our families, and we may have to have someone who is fluent in their language to share that information. And next slide. Just be aware of your state legal mandates and ethical concerns regarding telehealth. Develop a plan on how Latino children, youth, and families can reach you through the phone, email, or online platforms. Just a reminder, I think we all know this, but don't share your personal email or phone number if you can avoid it. And also set business hours, right? Because what we do know is when we get close with our Latino families, they will contact us for a lot, because then we become quote unquote family to them. And so we have to just ensure those professional boundaries as well, even if we have to reiterate it a few times in a nice way. Eventually our families understand. Establish procedures for Latino children, youth, and families to follow both in an emergency and non-emergency situations when you're not available. So that's reminding them that there are crisis hotlines, there are suicide hotlines, and they are in English and Spanish. And so sharing that information. A lot of our families will say, no, but I trust you, I have a relationship with you. And so just ensuring them that this is temporary. These are the other ways that you can get a hold of me within my business hours, but outside of business hours, this is who I need you to contact in case there's an emergency. Next slide. Providing telemental health, just knowing the steps to mitigate the confidentiality limits when you face that you may face when providing telehealth services, developing methods to minimize or prevent potential misunderstandings that could occur due to the lack of visual or verbal cues, and body language looks a little bit differently, obviously. And so just reassurance through tone, reassurance through voice volume, things like that. And be sure to provide information that is up to date. So some additional considerations for school as far as language accommodation, you can go to the next slide, I'm sorry, is this specifically for school districts and posting information, or having someone on standby when parents and caregivers call to receive information from the school or who have questions. So having someone who speaks the majority or the non-English majority language, if that makes sense. So in most districts, it's going to be Spanish if it's Latino population, but we do need to understand that Spanish is not the only language that Latinos and Hispanics speak. It's just majority language. And so having a language assistance line or person who's able to provide information is super helpful. Language accommodations for written communication. So when sending letters home, having them in English and another language, mass call outs by phone, having it in English and another language, district and school websites. Important information on there should be shared in multiple languages if you have a population who could benefit from that. And then social media updates, we're used to just posting in English. And so if you have a high percentage of Spanish speaking families, and posting in Spanish could be helpful. And then coping and crisis communication offered on sites in multiple languages. So this is our crisis hotline, our domestic violence hotline, bullying hotline, Crime Stoppers hotline, anything that could be of use during crisis. If you could have it in English and Spanish, again, if it's Spanish is the majority non-English language, then that's helpful. And then informed consents documents. And so if your district mandates that you have informed consent documents, then you want to have it in Spanish and English if possible. And then last week we had some written questions. We weren't able to get to them, but as you can change the slide in regards to migrant education. And so I'm not as familiar with that. When I was a school social worker, I would just go straight to our migrant department, and they were very helpful. But the Department of Education has an Office of Migrant Education. And so this is where you may want to contact your district migrant department if you need additional information, or go to the Department of Education Office of Migrant Education to gather information if needed. What I do know is our migrant children are used to moving around and per season, but it just depends on what's going on as far as what their stressors may be. And considerations for all providers, next slide, is just to really build your resource of immigration advocacy organizations, build your resources of Spanish-speaking organizations that are in your community and your city. Now is the time that we really need them, and probably need them, more than ever. There's a lot of things going on policy-wise that may impact your families. And so just knowing and being up to date on information is helpful. But we also know that there's so much information coming in right now. And so these organizations may have the most up-to-date information. Gathering local resources on financial assistance, food assistance, free mental health support. And then I know in Texas, we have the Medicaid transportation program that offers gas reimbursement or free rides to mental health, dental, and medical appointments. And so that's a way for them to get some money back whenever going to appointments. And so if a lot of our families are saying that they don't have gas money, or they don't have the money to get to appointments, the Medicaid transportation program will help them with that. I believe they give them, I know when I was working in the schools, they were giving out the debit cards, or sending them a debit card, and then they would just refill it through that way. When I was working in the hospitals, they actually sent them a check through Western Union, I think. And so just gathering all your local resources and building up your Spanish-speaking organization profiles will be helpful. If you can publish it on websites, that would be helpful as well. Next slides are just resources for children in English and Spanish. And so these are books that you all can download that will be helpful when just discussing the coronavirus and coping. Next slide is, it will show you the resources in Spanish. And all of this is on the handouts. And if you go to the legend or the key that's on the side of your laptop or computer, you'll see a section that says handouts, and you can upload these. We'll skip the next slide and go, skip the next slide. And again, there's more resources for school mental health providers. And then you can show the next slide. All of you guys can read this for yourselves. A lot of grief information, complicated grief, cultural considerations when working with different populations. And then this is a slide that I just want to share with you. There's a lot of trainings that are on these sites, the FERPA site for school personnel. The Department of Education has some information. The American School Counseling Association has some webinars. The School Social Work Net has some webinars. Can you go to the previous slide? NAMI, National Alliance for Mental Health, they have some great information, and the National Child Traumatic Stress Network, they have some really good information. All of these sites work with school-age children. And so they have the most up-to-date information that you can find. I know the School Social Work Net had a great presentation that they just put out last week. It was a school social worker from the state of Nevada who had to create their processes within 24 hours. She has a great flow chart on there of just services and how she's going to provide her district services through just kind of the virtual system. And it does address like suicide and homicidal ideation and how to handle that. And then the next slide is pretty important for our undocumented community. So we have the National Immigration Law Center, the Houston Immigration Legal Services. There's a website called My Undocumented Life that has some up-to-date information. And then the U.S. Citizenship and Immigration Services has some good, that's where you can find the public charge information. And then we have the Department of Education, Office of Migrant Education. So that's on the next slide. Again, it's going to be in your handout. I'm reading it off of my iPad. Just there we go. Okay, so that's some good information. And then we have some more educational resources. So I'll just let Cindy kind of flip through those pages and it'll show you some of the products that we have as an organization that may be helpful. It discusses cultural values, a cultural humility fact sheet, the cultural formulation interview tool. That is actually in the DSM. And so, so we have more products that may be available, may be helpful for you. And then that's the end of my presentation, or my portion of the presentation. Trying to think of if there's anything else I can add. So we're here for questions, I think, but I'll hand it back to Cindy. She knows.
Okay, so since we are pretty much done with our time, what we're gonna do, we're gonna answer your questions by email. I know that Isa has been answering some of your questions with direct reply. I just wanted to say that as a reminder, where you are asking the questions down below, you should see handouts, and you have both slides of today's presentation as well as other resources that the speakers share with you. So make sure you download. We have 4 handouts in total, so that's going to be really helpful. And besides that, we're going to go ahead and just forward your questions to the presenters just so that we don't